successfully achieved 3 very favorable milestones in our COVID-19 response. Over the weekend, we reported more than 74,000 tests in a one-day period. That's a new high for our state. We're also averaging now 52,000 tests each day, making our state tied for third in the nation, behind only California and New York. And on Saturday, Illinois became one of the first states to surpass 5 million tests since the onset of this pandemic. These nation-leading accomplishments have allowed Illinoisans to do what most states can't. There's a testing location and testing available for you if you feel you need one. And you can get one even without a doctor's order. For families, businesses, schools, and churches, that means there's a measure of safety here in Illinois that doesn't exist in most other states. So in addition to the people who stand behind me and who are in this room, I want to recognize some people who could not join us today as we acknowledge these successes. The tireless workers at our 3 Department of Public Health laboratories, one that's just across the medical complex here in Springfield, one in Carbondale, and one in Chicago. Our incredible Illinois National Guard, who stood up full-blown drive-through testing operations early in the pandemic, which has been held up as a national model. The fleet of federally qualified health centers around the state, now more than 100, who have helped us build a network of testing sites that are accessible and available. Our 25 state testing teams, including our mobile operations, which make testing available in communities that are high need but lower accessibility. The thousands of lab technicians, specimen takers, doctors, nurses, physicians' assistants, and healthcare workers all across Illinois who manage the testing process from start to finish, administering and monitoring COVID-19's presence in our communities and helping sick patients navigate the healthcare system when they need it most. All of these people, the unsung heroes, are the backbone of our testing infrastructure and the reason that Illinois is seeing relative success in fighting this pandemic today. Because of them, we are by far the best testing state in the Midwest. We've done 50% more tests than the number 2 state. Illinois is also a national testing leader. We do 3.5 times the testing that the average state does, and we're one of the fastest states in delivering tests back to our residents. In a pandemic, widely available testing and faster results mean our people are safer. In order to really get a sense of the sheer scale of what's been accomplished by IDPH and our world-class hospitals, universities, and clinics, it's important to remember the United States had no tests for COVID-19 at the beginning of this pandemic. IDPH worked hard to get the first test kit, making Illinois the first state to launch in-state testing for this coronavirus. That started in our very own state lab up in Chicago, which we quickly distributed to our labs in Carbondale and here in Springfield. Even so, materials were hard to come by. Swabs, reagents, primers, tubes, racks, pipettes, all were in short supply across the United States because there was no national testing plan. In the absence of a federal plan, we fought against all comers for Illinois to get the supplies that are necessary to make tests more widely available. In March, nearly the very beginning of this journey, our 3 IDPH labs could only perform a few hundred tests per day. By May, we acquired new machines, added new robotics, and helped healthcare institutions process more specimens, bringing our statewide test number soaring to nearly 20,000 per day. And since May, we've steadily added new in-state commercial labs and greater hospital and university lab capacity utilization to get to an average of more than 50,000 tests per day. That increased capability has allowed us to pioneer a flexible outbreak response through our mobile testing teams, which can be moved anywhere on any given day to mitigate and suppress emerging outbreaks, including places like meatpacking plants, nursing homes, migrant worker housing, Black and brown communities, and others less able to access traditional testing clinics. Mobile testing units allow us to quickly increase testing availability in areas facing high levels of community spread, as they are right now in Metro East. What connects all of these testing advancements is a commitment by our government to rapid improvement. That's the spirit in which we are operating. I intend for Illinois to remain a leader in the fight against COVID-19, in part by making sure we are on the leading edge of technology and its proliferation throughout the state of Illinois. That means looking to new methods of testing to expand our arsenal, from adopting Abbott's 15-minute Binax Now antigen test to expanding the use of our groundbreaking saliva testing developed at the University of Illinois Urbana-Champaign. It means continuing to ensure all state-operated testing sites remain entirely free to the public. And it means investing in the science that will end this pandemic by working with our higher education and research institutions to provide scientists with access to COVID-19 specimens for their work. So I want to say thanks again to all who have joined us here today. And now I'd like to turn it over to our illustrious director of the Department of Public Health, Ngozi Ezike. Doctor? There you are.
Thank you so much, Governor. I do also want to thank all the dedicated staff working in the Illinois Department of Health labs. We have with us today Kristen Goldsberry, who is the Springfield lab manager, and Justin DeWitt, our chief of staff. All of the teams at the labs have been working for months on end, working very long hours every single day, all week, including weekends. Illinois, as was just recounted, was the very first state in the entire country to be able to provide COVID-19 testing in the state health department labs, which allowed for increased testing with much faster results. Testing, as you are likely well aware, is crucial to not only identify those who may need treatment, but to isolate those who are infected as well. And it also helps on a macro level. Testing informs what additional measures we may need to put in place to further slow spread. It also helps investigators identify potential cases, often someone who is a close contact of the confirmed case, so that that individual can quarantine to reduce risk of further possible spread. Of course, I also want to thank all of our partners who have joined the ranks to provide accessible testing to communities across the state of Illinois. Partners like the SIU Federally Qualified Health Center, that's offering testing at Abundant Faith Christian Center right here in Springfield. IDPH has 11 community-based testing sites around the state, as well as mobile testing teams that are deployed each week to various locations throughout Illinois. One of those mobile testing teams will be in Springfield this Wednesday and next Wednesday at the State Fairgrounds across from the grandstand. Anyone can go there to be tested. You don't need an appointment, and you can go to any state testing site. You don't need symptoms, you don't need a doctor's referral or order, and there's no cost to you. Information on this location and hours for the other state community-based testing sites can be found on the IDPH website, as well as information on where other mobile testing teams will be every week. I know there are some communities that lack COVID-19 testing. Some healthcare providers, clinics, and hospital systems have criteria that may limit the number of people who are tested. Such barriers, such as the need to be symptomatic or to be part of a certain health system, may block some people from getting testing. We are reaching out and asking that these providers remove these barriers, open up testing resources to the public, and join IDPH's network of lab providers to partner in fighting COVID-19. Testing is such a critical step in reducing spread. A positive result begins the contact tracing process, which identifies who was exposed and who needs to be quarantined to prevent further spread. The best, actually the only way right now to control this pandemic is to reduce exposure through masking and social distancing. And we're marrying that with a strong statewide testing program. As the governor mentioned, we have exceeded 5 million tests in the state of Illinois. And in the last 24 hours, over 38,000 tests were reported for a total of now really 5.14 million tests. We are excited to celebrate this COVID-19 testing milestone and even more excited for the innovations in testing availability, rapid resulting, and ease of use that are on the horizon. Today, we are reporting 1,477 new cases and unfortunately 7 additional deaths. In total, 275,735 individuals in Illinois have been confirmed with COVID-19. And the total lives lost are 8,457. In the hospital overnight, there were 1,436 battling COVID. And as I say every week and will continue to say, please remember the 3 W's. Wear your mask, watch your distance, and wash your hands. And I haven't figured out how to make this a W, but also get your flu shot. Thank you. Now, a quick review for our Spanish-speaking population. Quiero mandar un gran gracias a los trabajadores de laboratorios del Departamento de Salud Pública de Illinois por trabajar noche y día los 7 días de la semana. Illinois fue el primer estado del país en poder confirmar pruebas de COVID-19 en los laboratorios del estado. Eso nos permitió aumentar las pruebas en Illinois con resultados más rápidos. Las pruebas son cruciales no solo para ayudar a tratar y aislar a las personas infectadas, sino también ayudan a un nivel mucho mayor. Las pruebas informan qué medidas adicionales debemos implementar para ralentizar la propagación. También ayuda a las investigadoras a identificar casos potenciales, a lo menos que es un contacto cercano de un caso confirmado, para que pueda poner en cuarentena y reducir el riesgo de una posible propagación mayor. Me gustaría agradecer a todos nuestros compañeros como el Centro de Salud Federalmente Calificado de la Universidad del Sur de Illinois, que ofrece pruebas en el Centro Cristiano de Fe Abundante aquí en Springfield. IDPH tiene 11 sitios de prueba basados en la comunidad en todo el estado, así como equipos de prueba móviles que visitan cada semana en varios lugares de Illinois. Uno de esos equipos de prueba móviles estará en Springfield este miércoles y el próximo miércoles en el State Fairgrounds frente de la Estantería Grande. Cualquier persona puede ir allí para hacerse la prueba o en cualquier sitio de prueba estatal. No es necesario que tenga síntomas ni una orden del doctor y las pruebas no tienen ningún costo. En el sitio web de IDPH se puede encontrar información sobre las ubicaciones y el horario de los 11 sitios de prueba basados en la comunidad del estado. También hay información sobre dónde estarán nuestros equipos de prueba móviles cada semana. Desafortunadamente, hay unas comunidades que les faltan las pruebas de COVID-19. Algunos proveedores médicas, clínicas y hospitales tienen reglas que limitan el número de personas que pueden hacerse la prueba. Por eso yo necesito preguntar a todos los proveedores de eliminar estas barreras, abran sus recursos de pruebas al público y se unan con los otros laboratorios en una lucha contra COVID-19. Las pruebas son un paso fundamental para reducir la propagación. Un resultado positivo comienza el proceso de rastreo de contactos, que identifica quién estuvo expuesto para evitar una mayor propagación. Pero no se equivoquen, las pruebas son solo una parte de la batalla contra este virus. Digo esto todas las semanas y lo seguiré diciendo. Usa tu máscara, cuida su distancia y lávate las manos. Y no se olvide vacunarse contra la influenza. Gracias. And with that, I will turn it over to Senator Menard.
Good morning. Thank you all for being here, and to Memorial Medical Center, and whose CEO, Ed Curtis, is standing in the back. Ed, thank you for hosting us, you and your staff, this morning. Illinois is the #1 testing state in the Midwest and is a leader in the country. And this didn't happen by accident. This happened because of the diligent work of the Pritzker administration and the staff and partnerships that have been built around the state. I want to go back to a morning in January here in Springfield. I was with the governor and Dr. Ezike when the governor signed legislation that the General Assembly had adopted to cap the out-of-pocket cost of insulin. If I recall correctly, that was the day of the first confirmed COVID-19 case in Illinois. On that day, there were zero tests, certainly not anywhere near to the scale of what we have today. But the state has gone from 0 to now 50,000 with that capability because of diligent work that has been done across Illinois, led by Governor Pritzker and his administration. I would tell you, as a legislator in downstate, the governor and his administration has listened to my concerns each and every step of the way. This doesn't happen without everybody working together, from the National Guard to the 97 local public health departments in Illinois, to the staff in each of those locations, the staff of the Illinois Department of Public Health all over the state, and from private partners both in healthcare and in clinics around the state. All of these things have worked in concert with each other to make Illinois the leader that it is today, despite the continued challenges that we have, and despite the lack of support and the lack of a national effort from the federal government. So I go back to that day when the governor signed the insulin bill here in Springfield to say that obviously much has changed. So many challenges have been placed before us, both on a health perspective, an economic perspective, on the education front, impacting the daily lives of the state's citizens at every turn. But this is quite a feat in my book. To be able to cross the thresholds that we have crossed as a state, despite the challenges, is because of the leadership of the governor, the leadership of Dr. Ezike at the Illinois Department of Public Health, and because of the boots on the ground, the names that won't ever be mentioned in press conferences, the names of the employees, the state employees who work very hard for the health and well-being of the people of Illinois. They're not going to get their names mentioned because they're numerous, but it is because of their work and the work of the partners around the state that we are in this very good position today. So with that, I appreciate the invitation, as always, to be here, Governor, and I appreciate your efforts. And now the governor will be available to take questions from the media. Thank you.
Thank you, Senator. Thank you very much. Just before I take questions, I just want to add that it was actually Senator Menard's bill that reduced the cost of insulin for everyone in the state. I was very pleased to sign the bill, but it was his very diligent work to get it passed in the General Assembly. And as always, he defers credit to other people, but deserves it himself. With that, happy to take questions from members of the media. Greg. Well, let's start with there are a lot of other things that are at work here other than testing that affect whether or not we would have certain sports available to be played by high schoolers in the fall. Let's recognize quite a number of sports are actually being played. I think that sometimes gets lost. The doctors, the epidemiologists have determined that certain sports, for example, cross country, tennis, baseball, swimming, there are quite a number of sports. There's quite a long list of relatively low risk sports that have been allowed as a result of the decisions by our doctors. And I think their concern, and I don't want to speak for the science behind it, but I have read some and heard some from them, that I think their concern is that certain sports that are high contact sports are likely to result in the exchange of sweat, saliva, and so on the field and even off the field. So I think that's why they have recommended against having full contact. They are not recommending necessarily against the kinds of warm-ups, training, and other activities that occur by those teams, and certainly I would encourage that. I think it's absolutely welcome to have kids out playing and being outside this fall, and so I encourage that. Just back to something you said at the beginning, I don't want to take credit for being the best testing state in the nation. We're third highest among all the states. We're certainly the highest in the Midwest, which I'm very proud of. And I also want to say that the reason that we have overall concerns, if the reason we aren't just letting everything go at this point, why not just remove all the barriers? Why not just go to phase 5? Why not? And the answer is because the virus is still out there. Because we still have a relatively high positivity rate. It's lower than our neighbors, that's true, but there are quite a number of states that have a lower positivity rate than we do. We have areas of Illinois that have positivity rates that are higher than some of the highest in the country, and we want to make sure that those folks are kept safe, and that's why we've broken the state down into 11 regions, and we're monitoring closely. And you saw that we alleviated the restrictions on Region 7 just the other day. You've also seen, hopefully you're all watching, Metro East is coming down in its positivity rate, and we're rooting for them. They're starting to get it right, and it's down in the mid 7s. Actually, I saw recently that it might be dropping below 7. So I'm prayerful and hopeful that they'll get there and we can remove the mitigations that are on them. Mark? Say again, I'm sorry. Well, first of all, let's all, take 3 seconds of moment of silence for the Bears winning yesterday, holding out in those last final seconds. Very pleased about that. But look, I want fall sports, all fall sports. I want fall football in high school to play. I do. And we look to the NFL and the college sports for what they're doing to keep those kids safe, to the adults and the kids safe. And what they're doing, of course, is massive amounts of testing, massive amounts of medical procedures. For example, myocarditis is being tested for in anybody that tests positive. We're seeing locker rooms that are being sanitized on a daily basis, more than daily indeed. And there are just there's a bubble around many of these teams so that they're not interacting with members of the public. I mean, it's a lot different in high schools across the state of Illinois. High schools can't afford to do that kind of thing. And it's too bad. I mean, I would love to see high school sports like football played. Meanwhile, sports that are more spread out, baseball, swimming, other things like that, are being allowed, and I'm glad that they're able to play. And I want very much to see the other sports begin to play. I'm going to listen to the scientists and the doctors about that. Yeah. Sure. I don't doubt that they're good parents. I don't. And I know that many of them want their kids to play. Some of those kids want to be able to play because they want to develop a record so that they can possibly get a scholarship to college, and I want that for them too. These are very, very hard choices. There's no doubt about it. My job, in part, is to weigh those choices, but it's also to listen to the doctors. And what I want most of all is to keep these kids and their parents and their grandparents and their neighbors and friends safe. This virus is still out there. It's still being transmitted. Even young people who have been much less likely to get very sick carry it with them and then give it to people who may have a comorbidity or others who are just elderly, and you've seen this has a terrible impact on the elderly. So we're trying to weigh those things in the balance here. If we were only focused on, the question of making sure nobody got COVID-19, we might tell everybody literally to go home, stay home. We haven't done that even in the beginning. The stay-at-home order was not everybody staying at home. So we're doing the best that we can, but most of all, the reason that Illinois is doing as well as it is that we've been listening to the experts. I'll just take a question from somebody else in the audience. Mm-hmm.
The testing costs seem to be dropping in many cases.
Mm-hmm.
If there is an organization or a school that can meet some sort of testing parameters, could that factor in, similar to college and pro, in loosening some restrictions?
Well, I think that should play an important role of how much testing that you're doing, how much effort you're making to keep the kids from interacting in ways that would keep them safe. So I'll leave it to doctors to opine about that, but I agree with you. The cost of testing is coming down. That can only be a good thing. More testing is better, but I can't speak to whether that changes the contact on the field and the transmission level on the field. Testing, great, after you've gotten it, then we would know that you had it, and we could isolate kids immediately or relatively immediately, but I just, I'm suggesting to you that ultimately, I'm going to take the advice of the experts about that, but I agree with you that more testing is always better. You had a question for Dr. Zike.
Yeah, no, that's a great question. So we want to have every test counted on everyone in Illinois so that our numbers can be as accurate as possible. We obviously can only calculate and do math off of the lab tests that we receive. We were made aware of the fact that Barnes-Jewish particularly had lots of tests from Illinoisans from the Metro East area. So we have worked with them. We've worked with their hospital leadership, their laboratory leadership, to make sure that they are sending those lab results electronically so that they can be counted towards the total and give us our most accurate number. Great question. So when we tell you how many tests were resulted over the last 24 hours, that's all tests that we've gotten. We're not taking out saying, oh, this is your third test. We're not counting it. Every test that was done, that's what's added. So I think that's answering your question. Yes. That's the most accurate number. That's the most accurate number to say out of all the tests that were done, because people's status can change. So out of all the tests that were done for that day, how many were positive that day? So that is giving you the test positivity, the most accurate for that day, and not filtering out. Thank you.
And I'm sorry, I do want to partly answer this just to say, every state measures this in the same way. And we do count all the tests because that's the appropriate way to do it, again, to measure ourselves against what the WHO, what the CDC recommends. And you're right, in a way, that somebody who does multiple negative tests would tend to drive the number down. And so that's something that I think everybody takes into account when they look at the numbers. It's important to recognize that the CDC has set a number for test positivity, 5% being a kind of a breaking point at which they're concerned about folks who are above 5% and less concerned about those who are below. But suffice to say that we're doing it in the way that everybody else is measuring those tests. Yes, ma'am. So as you know from the beginning, what we've done is had conversations with and meetings with the various utilities to get them to voluntarily agree not to shut off utilities. We continue to work with Ameren to try to get them to give people time. They may be getting shut off notices, but the reality is that people are given more time as a result of the work that we've done with the various utilities. We're going to continue to do that. I want to protect utilities, but I do want to also make sure people know that there is a limit to what the kinds of things that we can order businesses to do. And what we want is to try to measure and maintain, most of all, the safety and security of families, but also take into account the things like landlords, as another example, who over time, have, there are people who own multiple, units in the same building, for example, a duplex, where you're living in one side as a landlord, you're renting out the other side, and you may be doing that as a way to earn money for yourself, and that may be your only source of income. So we're trying very hard to look for ways to kind of balance these interests. We'll continue to do that with the utilities as well. I'm sorry. The question was about Justice Ginsburg, and let me begin in the replacement effort. Let me begin just by saying how saddened I am and so many people I know are by the loss of this really great Supreme Court justice, someone who we all revered, I think, on the right side on the right and on the left. People understood her to be a great intellect and somebody who cared deeply about standing up particularly for the rights of women and girls. Having a 17-year-old, now an 18-year-old daughter, just turned 18 this weekend. Her rights, in part, have been determined by the work that Ruth Bader Ginsburg did. And so I'm deeply saddened, and I hope that the nation takes note here while everybody wants to dive into the politics immediately, but I do think it's worthy of noting that there are some great people in the world who serve in public office and who make a real difference in their lives, in the lives of our people. In terms of the politics of this, I believe strongly that the Republicans should listen to their own words, that they're the ones who dictated back in 2016 that Merrick Garland should not be considered by the Senate until after the election, until we knew who won the election. These very same senators now seem to be hypocrites, changing their position. I think they should listen, particularly with 42 days or 43 days left in the election cycle. It seems to me that they ought to replay the tape of themselves from back then and listen to their own advice. And look, the President of the United States, whoever wins the election, ought to be the person who will ultimately determine who gets nominated for this open position.